Hello everyone, welcome to my podcast Crisis in Canada, and my name is Zubby and I'll be your host today. And in today's episode, we'll be talking about the opioid crisis. To start, I'll tell you a little bit about opioids and who they're for. Opioids are painkillers and they're usually prescribed to people with chronic pain or after a surgery. And they work by bonding to opioid receptors in the brain, so they basically stop the body from feeling pain or feel a lot less pain, and over multiple uses, the brain starts to develop a tolerance and requires a higher dosage to feel the same effects. Some examples of these opioids are morphine, codeine, oxycodone, and fentanyl. They can be really helpful, but they're also very addictive. The problem is when they're prescribed by a doctor or physician, they can lead to addiction because they're very powerful drugs. And cutting the opioid out cold turkey can usually lead to withdrawal symptoms in people. Some of these symptoms include anxiety, muscle aches, insomnia, sweating, abdominal cramping, diarrhea, and there's many more. People who are unable to control their dependence may look for these drugs or alternatives like crack or heroin in the streets. In 2016, there were around 2,500 overdoses, and those are the ones that can be directly linked to the use of opioids. There are still other people who transition off to other drugs, and there's also some people who end up dying because they've taken MDMA or marijuana that's laced with fentanyl. In my research, I came across a paper by Mark Tyndall, who is an executive medical director of the BC Centre for Disease Control and a professor at the UBC School of Population and Public Health, in which that he states that based on the current trends that opioids may be abused by younger generations in the near future. To make matters worse, the use of opioids is really starting to trend in music. There have been many artists like Mac Miller and Juice WRLD who have recently died because they've overdosed from opioids. In 2006, there was a study done by Brenda Meng Jin and Joel Miller that states that rap music in particularly is linked with alcohol and substance abuse, and it also suggests that adolescents may be more likely to partake in these activities because of the music, or there may be another variable that they have not been able to determine. Artists still decide to promote these drugs, and it can have a very negative effect on teens. 2 years ago, when I was in high school, there was a girl in grade 9 or 10. She decided to cut class and go smoke marijuana with her friends. Unfortunately for her, that marijuana was laced with fentanyl, and as soon as she smoked it, she started seizing up. Her friends called 911, informed the school, and luckily, in the nurse's office, there was fentanyl kits. Fortunately, she was fine after the incident, but you also gotta realize that if you're buying drugs off the street, there's a very good chance that they might be laced or cut with something else. One approach to fixing the opioid crisis is introducing new drugs. One of these drugs is called methadone, and basically methadone has a long-lasting effect which will last a couple days, unlike heroin, morphine, oxycodone, and a few others, which last in the body and brain for a short amount of time. Like all opioids, methadone causes dependence, but it is better because it produces minimum tolerance and you have less cravings for the drug. That's why it's used after stronger opioids. Methadone can be used as a treatment, it reduces relapse rates, and it allows people to enter back into their normal lives. Another drug that is used is called naltrexone. This is given to a person once they are clean, and all it basically does is cancel the feeling of pleasure from these drugs. It can also be used to detoxify people who have opioids in their system. There are many more medications that can be given to a person to help them be clean, like buprenorphine and LAAM, but it may not always work. One factor that cannot be quantifiable is the person's will to quit. Only when a person is fully committed to rehabilitation is when they will successfully be clean. Some other factors that can help people quit are injection sites, which are also known as overdose prevention sites. They offer clean needles for people to use, and they're also staffed with peers who are willing to take any actions if an overdose happens. These actions can include contacting first responders or even having to administer fentanyl kits or other medicines to prevent the overdose. There are approximately 15 injection sites in Ontario. Working at these sites can be very demanding and can take a big toll on people, and employees are very burnt out. and underpaid. To improve these sites, they should hire more people and they should also compensate the workers better because this job can be very, very gruesome. As of right now, there's a small percentage of people actually using these sites. They are helpful because people are not dying in these locations because of the supervised activities they're performing and diseases don't get spread. In my opinion, drugs should be taught about and they should be a big part of the education system because many people are one day going to have to make a decision to either use a legal or illegal drug, and they should know what the good and bad can be and what are the possible outcomes of their decision. One way that I know is very effective is that you can have people who have experience with drugs. In my elementary school, we had a former member of the former member of the gang Hells Angels come in and talk to us. He told us about his life and what had happened to him. When he was very young, he went out with some man and he forcibly made him inject heroin, and he told us that that was the worst decision of his life. Ever since after that day, he's never went back to his home, and he became one of the most wanted in Canada for a period of time. But eventually, he said, I can't do this anymore. He ended up going to prison, and then he graduated there, changed his life, and now he advocates at schools. I believe his story was very moving because the way he connects with children really helps them understand that some of these decisions that they make in their young adolescence, or even if they don't make them, can have a really negative impact on the rest of their life. Another way to educate children is by getting parents involved where possible because for most people, parents are a role model, and if a role model is telling you that, hey, you should make a wise decision, you should never be doing certain things that can ruin your life, it will impact the children in positive ways. In the end, this epidemic is very severe and it needs a solution soon. May the solution be using other drugs to help people wean off of these drugs or help them stop crave them. Another possible solution is if parents, school systems, they all can try and start teaching kids at a younger age what the consequences of drug abuse are. I'd like to say thank you for listening to my podcast about opioid crisis in Canada, and thanks for listening to Crisis in Canada with your host Abhi.